Nihipali.
Punaboy, Webmastah.
Yes, having a great day in the Little Grass Shack as the holiday season is upon us. Today's Hanaho Spotlight, we have the lovely Miss Emelina Quisumbing, Dr. Q, from the FIRSTMED. Aloha, Dr. Q.
Hello, everybody, and thank you for having us back again on the Little Grass Shack. It's always fun to be here.
Thank you very much for taking time out of your, I know you're a busy person, and you were here last year at the same time, and we were talking about FIRSTMED, and it's just so intriguing to me that what the cause is to help people out there that cannot afford, cannot afford healthcare people, and this lovely lady had put a non-profit organization to be the the driving force behind the community. No, thank you very much, Dr. Q. So can you kind of tell our listeners again, what is FIRSTMED?
FIRSTMED is a clinic.
Yes.
It's a non-for-profit clinic that's been serving the Las Vegas community since 2009. We have an incredible, dedicated staff. We take care of the most fabulous patients who, unfortunately, one reason or another, have not had the luxury of having access to health care, and that's why we are here. We're here for them.
And then, what was this? I know you being in the field, being a doctor, it's just one of the something that you want to just, create for the community, and like from your heart. It was just one of those things that were in your mind, like, look, the people needs a program like this. And how did you rally people to, get connected with you and, bring this group alive?
Well, unfortunately, I was witness to the very dire lack of healthcare access in the community, especially preventive and primary health care. Our town suffers from the fact that we do have a lot of uninsured patients who because they lack access to care, end up in emergency rooms and hospitals when we could have avoided that situation altogether. FIRSTMED has made it its mission to make sure that people in our community have a place to go where they can be seen in a place where they can feel like their healthcare needs are being taken care of, and where they can have physicians and providers who are committed to making sure that they stay healthy.
So they can go to your to the FIRSTMED Health and Wellness Center, whether they have insurance or not, or if they have limited insurance, they can seek your help.
Yes, in fact, the clinic was really built around people who are unable to afford insurance, or do not have access to insurance altogether. So we see everyone. No, and for those that are uninsured, we have a sliding scale. No, and so we really want to make sure that the community is aware that they have a place to go to if they have limitations in access to healthcare, particularly if they're uninsured, or they have a high deductible insurance that they cannot use their healthcare, or they have other limited resources, including having a low income, or having transportation issues, having translation issues. FIRSTMED is the place where they can be seen and get that best quality, low cost care.
Now, FIRSTMED, is it just for a common cold? I know females that need more different needs for healthcare. Does it cover all of like OBGYN as well as infant care?
Yes. In fact, we were recently awarded a federal grant and allows us to expand our services to see the pediatric population. And we were very fortunate to have brought in a provider that not only specializes in family practice but also in OBGYN and women's services. And so we really see that entire spectrum of patients from peds to adolescents to adults to elderly. And we also are able to deliver care for women of childbearing ages.
I tell you, Dr. Q, we'll stop. We're going to come back with Dr. Q in the Little Grass Shack. And, if you guys have any questions, number 2 Little Grass Shack is
702-895-5868.
And Dr. Q will be in the Little Grass Shack for the next 30 minutes. So if you guys do have questions, give her a call. It is a how you say, a great a center, a wellness center for you folks to partake in, and we'll talk more about that. I'm Emory.
Punaboy, Webmastah.
91.5.
Your source of aloha.
Emory.
Punaboy, Webmastah.
And right now we've got Dr. Q from FIRSTMED. Welcome back, Dr. Q.
Thank you.
You know what? During the break, it's so exciting, so much energy in the Little Grass Shack about what Dr. Q is doing here in Las Vegas, for the people. And she just reminded me that they just got a federal grant, and it took how long?
We have been preparing for this grant for the last 4 years, and the federal grant actually allows us now to be officially a community health center, and it's a very competitive grant, and it's the first designation in Nevada in the last 16 years, and the first one that is based in Southern Nevada. And so we feel very fortunate to be the clinic to be able to bring this community health center model into our community and continue to serve our community that way.
People, 16 years for a federal grant, and it's not easy to come by, and with the healthcare market going up, and Obamacare, everybody's in the scarce of trying to get healthcare by the first of the year. Now you guys have a health and wellness center right here in Las Vegas, and it's backed by a federal grant. Dr. Q, with the what is the physicians? How does the physicians be part of the community center?
We actually have a couple of fabulous providers. We're very lucky to have them. Dr. Laura Cully, who's our chief medical officer, is a very well-respected internist in town. She has a passion for taking care of people in the community that especially lack access to care. We have 4 other licensed family practice nurse practitioners who, if you meet them, you will just simply fall in love with them because they are just so dedicated with making sure that our patients are taken care of.
Now, licensed physicians, RNs, or nurses that are here in the community to help people that are looking for health care, and backed by a federal grant. I mean, it just sounds so surreal, And we've talked last year about the goal of trying to accomplish and achieve this federal grant. And congratulations, I'm telling you.
Well, thank you. Well, I want to make sure that the community is aware that this is for them. The reason why FIRSTMED Health and Wellness Center exists is for the community, and our ability to be able to serve them better and provide that low-cost, quality health care that's so needed in this community is really the reason why we've worked so hard to make sure, that FIRSTMED is now a community health center.
If you guys have ever, visited a emergency room for a common cold, that's $500 to $800 a shot just for a common cold. Now you guys have an out to check out FIRSTMED to help you guys out, and just people that care. Because every time you go to the emergency room, and nothing against emergency rooms, because they are there, I just feel like another number. When I'm sitting there and in pain, or just waiting for the somebody to assist us. But again, I understand the medical field. It does take a process. But now we have the FIRSTMED Wellness Center. I just can't believe it. Congratulations.
Well, thank you, thank you. Well, there's one more thing I'd like to share with you.
Actually, we're gonna hold off on that because we're gonna have Dr. Q talk about there's a lot more things happening with FIRSTMED. I know she's talked about getting in the community and getting you guys to come down and invite you guys to understand what the FIRSTMED family is all about. So we'll talk to her more about that. But we got more music coming your way, and more with Dr. Q. I'm Emory.
Punaboy, Webmastah.
On 91.5.
Your source of aloha.
birthday shout out going out to Gayla. She's representing the big MI. And
Gayla's birthday?
Belated birthday.
Belated birthday.
Yes.
Oh my goodness.
Oh my
Happy
goodness.
birthday.
Happy birthday. We still got Dr. Q in the Little Grass Shack. You know, I'm loving the excitement, people calling in and talking to her. And you know what? Feel free, man. There is a website you can get connected with FIRSTMED, and that website is
www.firstmednv.org.com.
FIRSTMEDNV.org. And we have posted that on our FBI, along with FirstMed's Facebook page, so you can get hooked up that way.
Thank you.
With your the medical care that you provide, you also provide dental care,
Screening.
right? Dental screening.
Yes. Our goal is to be able to provide comprehensive preventive and primary care. And so for all our patients, we allow the opportunity to have them have screenings for cancer, for dental, for behavioral health, for infectious disease. And that's a really important way for patients to be able to make sure that they're healthy, that they have availability of all these screenings.
So FirstMed, you cover all areas of health.
Yes, we'd like to be able to provide this comprehensive care. That's the only way we feel like we can make a real difference in someone's life.
I mean, well, okay, let's talk about your thoughts on Obamacare. What is your thoughts? I mean, you know, from what I've heard, it's just one of those things that's too expensive. People think they're not going to get the quality service and stuff. So, what are your thoughts on Obamacare in the general?
Well, the Affordable Care Act specifically does two things for the people in the community. That they really need to be aware of. One is the Medicaid expansion, which means that the Medicaid program will be able to accommodate more people into their program that would otherwise not have insurance of any kind. And then it also allows people who are uninsured through the insurance marketplace to be able to get some kind of affordable insurance. Now, so what does that mean for people who are uninsured? It gives them the ability to have access to health care and see a regular physician and get their health care needs done. How FirstMed plays a really important role there is that we, as a federally funded community health center, we are able to determine eligibility for Medicaid and the insurance exchange on site. So we have a caseworker, her name is Maria, who you will love, will be able to take you through the process of determining whether you are eligible for Medicaid or the insurance exchange and enroll you directly into these.
And right here, right at the office, it's right on site.
Absolutely. One-stop shop.
One-stop shop.
Speaking of office, where is FirstMed located?
Well, FirstMed is in the heart of central Las Vegas. It's at 3343 Southeastern, and it is very close to the DI intersection.
Desert Inn and Southeastern.
Yes, absolutely. It serves the Paradise and Winchester neighborhoods of Las Vegas, so it's very close to UNLV where we're at right now.
But you also said that FirstMed is going mobile.
Yes, absolutely.
Mobile.
Well, thank you for reminding me of our mobile clinic, something that we are very proud of. We launched a one examination room mobile clinic in the fall, And very shortly, and we were awarded actually the Dignity Health Grant to be able to mobilize this mobile clinic. And our purpose is to be able to bring direct services to areas in the community that cannot readily access our clinic. So we want to be able to bring direct services.
Go to them.
Absolutely, and that's the way to do it.
Don't wait. Go to them. Don't wait for them to come to you. You know, with all the buzz of congratulations on your the finance. I mean the federal grant. Things are looking up for FirstMed. You're talking about an event that's going to be happening in the beginning of the year.
Yes, on January 17th, FirstMed is going to be holding a town hall. The town hall is our promise, to be able to educate the community and its stakeholders about the services that FirstMed provides, its role in the Affordable Care Act, and we would like to invite everyone in the community to participate. We would like to hear from our patients, from the community, from our stakeholders, how we as a clinic can better serve our community.
Yes. You know, it's just one of those things. It gets me because you are doing the work of for the people, for the community, and going out there and just achieving goals that 16 years now, and now you have licensed physicians, and I'm sure there is a long list of people trying to get involved with this program. And I know that this is the reason for the town hall. People, if you guys want to get involved, it's going to be January
17th.
It's January 17th. We're still looking at for a location, but we'll keep you guys all up to date on what's going on with FirstMed. And with the Obamacare, this is another opportunity, another way out for you folks to look for preventive health care.
Yes, absolutely. And I have to say one more thing.
Yes.
I have to say we cannot do this by ourselves. We are very fortunate to have the most incredible, dedicated staff, but also we have fabulous partners in the community, including the Little Grass Shack and many other wonderful initiatives in the community that we work with that are also passionate to make sure that our community has all the resources it needs.
Well, thank you, Dr. Q, for coming into the Little Grass Shack, and we'll hope to have you back in the Little Grass Shack and give us a little update of how everything is going. I'm sure we're going to get involved, and we're going to be at the town meeting, and on the 9, we'll be filming. It's one of those things. It feels good to give back, and also to help people and educate people that myself, I'm still learning about the health care and the whole thing with the Obamacare, and my wife's an RN. So I should be educated, but now it's like giving back to the people, and you guys, as the people, this is your opportunity to make a difference and make sure you guys take care of yourself, your family. You want to be around for your family. And thank you again, Dr. Q, for coming into the Little Grass Shack.
Well, thank you. It's always one of my best things to be here, so thank you for having me.
All right, people, we got Hopper coming up, as well as Willie K off the request line. Oh, holy nights. I'm Emory.
Punaboy, Webmastah.
We're listener supported 91.5 The Source, KMV Las Vegas.
Your source.